Let me introduce to you, in studio, we have Dr. Craig Slapinski. He is a clinical director at the Spine and Nerve Center right here in Ghana. And Joseph Ahenkra, he's the head physiotherapist with the Spine and Nerve Center. Gentlemen, you are both welcome.
Thanks
How are you
for
doing?
having us. Good.
Fantastic. Well, let me get right into it. So, a few years ago, I had a rude awakening that life wasn't as fancy and dandy as I thought, it had always been. A young man, very vibrant, very athletic. I always, then suddenly I began to have challenges with, when I sit, I put my arm, and then I'll start to have tingling feelings in my fingers. And then my whole arm can go numb and all of that. So talk to us about, I discovered what it was. It was an issue. So
Yeah, so more than likely that was a problem with your intervertebral disc.
Mm-hmm.
So if we look at the spine,
Yeah.
it's made up of bones, and these bones are separated by what's called an intervertebral disc.
Okay.
And then we have our nerve here. So when we have a problem, the disc can bulge out. It can bulge out,
Okay.
and then it can hit the nerve or the nerves that are going down the arm.
Okay.
So more than likely, that's what happened to you.
Okay. Okay. So let me just take a look at this. So this is interesting. So if there's pressure on the disc,
Yeah.
this is what's happening. So there are swellings. I don't know if you can see that. And,
Yeah.
and then that's pushing against the nerve. So this is the
That's
spinal
the-
cord
yes.
that's
Mhm.
running through?
Yep.
Okay.
And then these are the nerve roots where the nerve is coming
the
out.
nerves, okay.
So those are the nerves that are, if this is
That are
happening in the
being-
neck, that goes down.
Okay,
That goes
okay.
down the arm.
Wow.
So if we have another model here that we can look at, and you can see from the top down that you have a fibrous tissue that holds in
Yes.
like a jelly-like substance.
Yes.
And then that gel can bulge out. It can seep out and then hit the nerve. So that's what we focus on at our office.
Okay. Now, let's take it back to basics. Why do people even have nerve or spinal challenges?
Well, it's a process of mechanics, and it's a process of aging. So as we get older, the fibrous tissue that we're talking about that holds that jelly in gets weaker and weaker and weaker.
Okay.
So and then it's like a dam bursting. So all of a sudden the gel protrudes, bulges, herniates out, and
Yes.
then hits the nerve. And then it also can be part of, like, if you're doing a lot of sitting, or if you're doing a lot of lifting or bending, or if you're being in the car a lot, and in the roads here, you're bumping up
Yeah,
and down.
bumping, yeah.
So it's a degenerative process that takes place that weakens the disc.
Right. Now, let me ask. I know that there's the role of the chiropractor, and then there's the role of the physiotherapist. They're not the same. What's the difference?
Well, so a chiropractor's goal is to introduce mobility into the spine.
Okay.
So they want to get movement back into the spine. And the physiotherapist's goal is to rehabilitate, like with the muscles and make you stronger. There's a lot of overlap between the both.
Okay.
And for the best results, you want to have them working together.
Okay.
So at our office, we employ chiropractic, the spinal manipulation, the adjustments. We employ the physiotherapy, the active rehabilitation. But then the main thing that we have is the passive modality of non-surgical spinal decompression
Okay.
and cold laser. So it's the three of them together that helps to really make this a long-lasting process.
Non-surgical spinal decompression.
Yep.
Sounds like a whole complex thing. What's going on
So we talked about how we have the disc that's bulging out. So what the decompression table does is it gently pulls the vertebra apart.
here? Okay.
So where the table will pull, but what makes this table special is that as soon as the table begins to pull, your muscles begin to tighten up. So if we're just pulling, if we're just doing traction, then you're engaging the muscles, and then you're just stretching out
Yeah.
the muscles.
Yeah.
But that's not where the problem is. The problem is with the disc. So we need to bypass that muscle guarding reflex.
Okay.
So the way the table operates is that as we're pulling the vertebra apart, your muscles tighten up, the table releases.
Okay.
So while you're on the table, you really don't feel anything at all.
Okay.
Most people actually fall asleep
Yeah.
while they're on the table. For a lot of people that are really suffering, it's the one time where they're not in pain.
Okay.
So they get some relief, they fall asleep. So that's essentially how the decompression table works.
Yeah, yeah. Let me ask you, Joseph, working as a physiotherapist, what are some of the challenges that you see amongst Ghanaians, typical things that you see among Ghanaians?
So the number one thing is our posture. I mean, how we sit, how we bend to lift objects, how we even use our phone. Most of the
How we
clients,
use our phone?
yes, how
Wow.
we use your phone.
Okay.
Most Ghanaians
Yeah.
we like comfort,
Okay.
as especially how we sit.
Yeah.
We prefer to sit in a chair than we are laid back,
Okay.
rather than sitting upright.
Okay.
Even how we lift objects from the floor. We want to show, I mean, we are stronger and all that, and then we end up carrying more weight, and then we end up causing more problem to
Yeah.
ourselves. But the number one thing is how we use our phone. Even if you should take a public transport, if you should go out when people are using their phone, you see them with their head
Bent
down,
over,
bent
head
over.
down, bent
exactly. And then that repetitive movement that
Okay.
we keep going on, that is what brings about all of these problems. So those are the challenges that most Ghanaians, I mean, face.
Yeah. If you were to advise, right, to say, I come to you with a neck issue, and you identify that it's most likely to do with the way I've been bending over, looking at my phone, what would be your advice to somebody as to how to handle the phone?
Exactly.
How would you hold the phone?
Good.
How should I hold the phone?
Can I use your
Yes,
phone?
yes,
Good,
okay.
good. So ideally, if you were to use your phone, it should be eye level.
Okay.
Where you have the phone up, and then you can see it from the screen and then
Yeah.
easily type.
But it feels awkward.
Yes, but and in terms of privacy too,
Yeah.
because if someone is behind
Yeah,
it, I mean,
behind
the
you can
person
see
gets
the
to
phone,
see
yeah.
everything and all that.
Yeah.
But that is the best thing to do.
I see.
You know, your neck or your cervical spine has a curvature.
Yes.
And the curvature is there for a reason, to allow evenly distribution of weight
Okay.
when the weight comes on the spine.
Okay.
But then if we keep bending it over, it gets to a point where
It
we
starts to-
lose that curvature and
Yeah.
then it becomes straight.
Yeah.
So that means any weight that comes on the spine goes directly on it. And that is when we start to notice all those pain going down the arms, in the neck, and all. Some people say they just woke up one morning and couldn't turn the
Yeah.
neck. I mean, those are the things that go on. And
So the curve you're talking about is just as it's entering the neck,
Yes.
at the back there.
Yes.
Right.
So at the cervical region, when it comes to the medical term, they call it the lordotic curve.
Okay.
So something like a turned or reverse
It's
C,
like okay.
a reverse C curvature. Okay. And then when it comes to the mid and then the upper back, we call it the kyphotic curve,
Okay.
which is like a hunchback or something. And then the lumbar spine also has the same
own curve
curvature.
down there, yeah.
Yes, it has the same curvature as the neck.
Okay.
But most of the times, where the problem comes from is the neck and then the waist,
Okay.
because that is where, I mean, our postural problems and all, and then the weight
Yeah.
also. That is where we put most of our waist on, our weight on. Yes.
So let me, before I go back to Dr. Slapinski, a lot of people complain about waist pain. I dare say it's more of the lumbar pain that they're experiencing.
Yes.
Right?
Yes.
Okay. Why is that an issue? Why is that such a big? Because a lot of people complain about waist pain in Ghana.
Good, good. So, you know, the waist, would say, carries most of your body's weight. Okay. An example is when you are sitting, the weight that is placed or the pressure that is placed on the spine, on the lumbar spine,
Yeah.
is different from when you are standing and then when you're walking. But most of the work that we do here involves sitting. And then some people go to the office and then they end up sitting for more than 4 hours, 5 hours, 6 hours.
Yeah.
If they have to get up from the chair, that means they have to go and use the washroom or even find something to eat. So that consistent sitting and the pressure placed on the spine, that in turn gives us the waist problem that we have.
Yeah.
And then in return to, you also need to walk, you move around and all that, you are walking. So when you're walking, your spine is like moving this way. So it's like a
Okay.
pump action going
Okay.
on. Now, when your disc loses that integrity, then that is where the problem starts to come in. Yeah.
Okay. Doc, let me ask, you've been in Ghana for a while. How long have you been in Ghana?
3.5 years.
3.5 years. But you're based here now.
Yes.
What made you decide to?
Oh, well, when I graduated in 2007, I decided I like traveling, so I wanted to go someplace interesting, before I settled down. So I came to Ghana, worked for somebody, and I was based in Takoradi.
Okay.
And I met my wife, and so we.
She Ghanaian?
She's Ghanaian, yes.
Oh, wow.
So we moved back to the U.S., and that's where I got interested in the non-surgical spinal decompression. And after a while, being a doctor in the U.S. is tiresome because you have to deal with third-party payers, insurance companies, and there's a lot of paperwork, and nobody becomes a doctor to do paperwork. And so I just got I got ready to do something else. I wanted to try something else, and my wife was like, nobody does what you do in Ghana. They really need your services. Why don't we return to why don't we return to Ghana and open up a clinic here? So that's how we came here 3.5 years ago. So we were in Accra, established in Accra, and then we just opened up an office in Takoradi about 8 months ago.
Okay. Okay. So basically, at the Spine and Nerve Center, what are the range of services you provide?
Well, the primary one that we focus on is the back and the neck pain. That makes up about 70% of our practice. Our goal is to help people avoid medication, help people avoid surgery. So that makes up a majority of the practice. But the other thing that we do is we do knee arthritis.
Okay. Oh.
So people that are having chronic knee pain, what happens with that is, if you look at the model, this is your knee, and then separating the bones in your knee, you have what's called a meniscus, and this acts like a gel. It's like a shock absorber, a lubricant. And as we get older, this meniscus begins to wear out.
Okay.
So we have a procedure that will help to distract the knee and get more fluid back into the knee.
Oh, that's how you do it. So, okay, you just said fluid back into the knee. So
fluid
the
back into the meniscus.
The meniscus is fluid.
Yes. So it's another matrix. It's somewhat similar to the disc, but it's a fibrous material.
Okay.
That acts like a cushion. It acts like a shock absorber. And again, as we get older, if we're putting too much weight on the knee or how we're walking, if we're overweight, that's a big one. If we're overweight, you're going to be putting more and more pressure on the meniscus and causing that to degenerate.
Yeah.
So we can help to regrow and rehydrate the meniscus.
Wow. Can you talking about rehydrating the meniscus, can you rehydrate portions of the spine?
Yeah, well, yes, that's absolutely important. That's the one of the main benefits of doing this, because if you get older, the disc begins to dehydrate. It begins to thin. Yeah. So part of the procedure is that we're rehydrating the disc. We're getting more fluid into the disc, making it stronger.
And that would be by decompression.
Correct.
That would
yes.
be by decompression.
The other main thing that we do is called cold laser therapy.
Okay.
So the cold laser, and it's part of the procedure that we do with all of the things that we do, is we shine a strong beam of light into the disc or the meniscus, and that helps to increase circulation. It increases ATP. ATP is the energy of the cells.
Yes.
So it stimulates the mitochondria, opens up the ATP channels. We're getting more energy into the cells. We're awakening the cells, so it helps to heal that way. It's vital for what we do. Yeah,
yeah. Wow. Now, in terms of the general medical community, right? How are back and neck pains treated as opposed to what you do?
Right. So, if medically, they'll do pain medication or anti-inflammatories, or they'll do steroid injections, and finally surgery. Yeah. But none of those options really correct the problem with the disc. They'll mask the symptoms, but they're not correcting the problem with the disc. It's the same thing as that if your check engine light comes on in your car, and rather than dealing with the problem in the engine, you just put a sticker over that light. I'm not saying that surgery is never necessary, but a lot of cases that are going in surgically, they can be avoided, and that's our goal.
Wow. From the physiotherapist's perspective, you talked about the issues of lifting things wrongly, you know, sitting wrongly. These things are being some of the challenges that when people attend your clinic, what's your advice to them in terms of correcting the things that cause them? Because there's no point in coming to the clinic and being restored and then only going back to your bad practices, right? So what's some of the techniques you showed them in terms of fixing that?
When you come to our center as part of our treatment protocol, there's what we call the ergonomic education, where we get to know more about the kind of work you do, I mean, what you do, your daily activities. So we get more into that. And then we teach you the right things to do. An example is if, let's say, a banker comes to our center complaining of back pain or neck pain. So we know bankers do sit a lot. They use their computers too a lot. So one of the things that we tell them is, look, you need not to sit throughout the whole day. At least if you can time yourself, you can set an alarm or a timer on your phone where after every 30 minutes or every 40 minutes, you just get up, stretch out a little bit, and then you sit. Another thing to be the level of your computer or how your keyboard is positioned. So just like with the phone, the screen or the monitor should be eye level. And then if you'd want to lift an object up to, it is better to go on your knees than to bend forward to pick the object, because when you bend forward that way, you put more pressure on the spine. But then if you should go on your knees or you should try squatting and lift the object, you're pushing up with your legs, which is much safer. I mean,
put the pressure on your thighs instead of on your back.
Exactly, instead of your back. So those are some of the things that we put. And then one other thing too is how we sleep. I mean, the mattress that we use. I mean, Ghanaians more like, just like I said, comfort and luxury. we want to lie on the beds that are like, they have these ones that they call the water bed that will sink you inside and all that. Those are honorable because they change the normal alignments of the spine. So we prefer you get an orthopedic bed or mattress that you use that will give you proper support, I mean, to your back. So all of these are included in our treatment, I mean, protocol when you come to our center as well.
There's a photo on the screen. What are we looking at here? I don't know if you can see this.
So what we're looking at is a fusion. So you know what they're doing is they're physically using hardware space to take nerve off or pressure off of the nerve. So, but the problem with this is that your spine is like a chain. And all the links need to absorb like the appropriate force. So once you fuse these sections, there's going to be more force applied at the bottom and at the top, and then those are going to wear out. And then also your disc. Part of the reason we have so many problems with our back is because the disc does not get direct blood supply. So your disc needs movement in order to heal, and you're blocking that. Now there's no movement in the disc. And now what happens is that after the surgery, there's no movement. The disc will begin to break down more. And now what happens if you have severe back pain? There's no other option. You know the typical course is that they do something called a laminectomy. Is that's where they cut part of the bone out, and if that doesn't work, then they fuse it.
Wow, I have a message here. And I think you just answered that question. Good morning, I'm watching from Adenta. Does one's sleeping position affect the spine? So how should we sleep?
So when it comes to sleep, you can't really tell if lying on your back, lying on your side, or lying on your tummy is the best way to sleep. It all depends on how you do it. An example is if you should lie on your back, the best way is you get the pillow, but make sure the pillow doesn't go on your shoulders. So it's just from the neck coming up, and then you just support yourself as well. You could also get a pillow, then you just put it under your knees. You get, and that is much better.
So you're lying on the bed on your back. But there's one pillow behind your neck, not your shoulder. Your shoulder shouldn't be on the. And then one
behind your knees. If you'd want to do the side lying too, is you stretch one leg out and then you put a pillow in between the knees and then you just put it there. I mean, that is the best way for you. But what matters most is the quality of your mattress, because if that is still bad, then all these things, you still do this and you still wake up with pain. So the quality of the mattress matters more, I mean, in terms of sleep.
We have another image on the screen here. I don't know if you can walk us through what we're looking at.
Right. So, if we look at the blue images, those are healthy discs.
Okay.
If we look at the yellow, that represents the spinal cord.
Okay.
And then the red represents a severely herniated disc. So that's the problem, is that disc is bulging out and it's hitting the nerve.
Okay. Which is what you showed us earlier.
Correct, yes. Okay. So that's on the MRI. And it should be noted that just a majority of the patients that come into our office get an MRI, because the MRI will definitively show you what is wrong with you.
Okay.
You will be able to physically see on the image, this is where your problem is, and this is how severe it is. And then we can make the appropriate recommendations from there.
Fantastic. All right. Let me see. Okay, so it's the same message. I saw another message there. Right. So now, with the work that you do at the Nerve and Spine and Nerve Center, Ghana, what would you say is the unique thing about your service that you provide?
So it's effective. That's number one. Research will say it shows about a 90% efficacy rate, which is really high. The other thing is that what we do is safe. The biggest side effect to this is that you're going to be sore. As we're pulling you apart, as we're stretching you out, that causes some inflammation, and that's okay. It usually goes away after the first 2 weeks.
Sorry.
So this is the thing is that this is safe and effective. That's the difference.
It's safe, which is important. Because a lot of people hear about the need for surgery when it's something to do with their back, and then people become afraid because they've heard stories, horror stories, of they went for a back surgery, now they can't even walk. And they went in walking, they walked in,
Right.
and all of those kind of scary things that happen. So once it's safe, that's a good thing. Right? Walk us through what we're seeing here. I think this looks like another herniated.
Yeah, so this is another herniated disc. So we can see, this is the top-down view. You can see the nucleus, or the gel material, bulging out and hitting the nerve.
Sorry.
And there again at the...
All right. So just like Doc was explaining, so you see so this is a cross-sectional view. The one on your left is a cross-sectional view of the disc, and then you can see the inner content just coming out and then putting pressure on the nerve. And then that is how it shows from the lateral view as well.
Okay.
So once it puts pressure on the nerves, then you see the nerves at your lumbar spine or your waist level, they are the ones that go all the way down your leg. So once the pressure is placed on them, then you start to get the pain, the numbness, the burning sensation, the pins and needles, all of that going down your legs as well. So that is what happens when the nerve is compressed.
Super. Yeah, talking about the pins and needles, I experienced that. It was quite horrible. This is about 3 years now. But I remember if I'm driving and I happen to rest my arm on the armrest in the middle of between the seats, my entire arm slowly would just start becoming numb, and have pins and needles in my fingers and would start coming numb. If I lift it up, I'm okay. And then I had the same thing on the right side as well, and that one, the windows open, roll it down, put your arm out there. Oh, the pain was horrible. So I'm now beginning to understand what was, behind all of that. We have a final image here. Just walk us through what we're seeing here.
So, when we have a herniated disc, it's through, the pressure is increased. And so we can see here that there's too much pressure, which is causing the disc to bulge out. And then here we can see that we're pulling the vertebra apart. And this graphic is showing the water, the fluid going back into the disc. So it's rehydrating the disc. So we're reducing the pressure on the disc, making it stronger.
So it is possible to rehabilitate, if it's caught early.
Well, the earlier the better. But
Yeah,
I mean, the more disc that you have, the more disc we have to work with, the better the results are going to be. So certainly coming in, earlier, your results will be better, and it'll take less time.
Right. How do people get in touch with you?
So if you need to call us to book an appointment, our call line is 0249 999 127. So I'll repeat the number again, 0249 999 127. So you can call us, and our lovely front desk will be willing to talk to you, tell you more about what we do, and also help book you for an appointment. We are also located at East Legon, on the Menswood Avenue stretch. We're on the same stretch as Ghana Link.
Okay.
So it's easy to just locate us there. And then in Takrady too, we're at Anaji, behind the Anaji police station. And just on that stretch, you can also locate us there in Takrady as well. But then I also say we work solely by appointment. And so you need to call to book an appointment for us. And then we are offering something special for the first 10 callers that will call to book an appointment. So the first 10 callers, we have something special for them as well.
Right.
Yeah.
You won't tell us?
No.
It's the first time hearing of it.
Okay, something special for the first 10 callers. That's good. That's good. That's good. Well, thank you. Thank you very much for sharing this. This is fantastic. Let me ask this, because this is just my personal interest. So when I did my chiropractic care, and then I had relief and everything else, what I decided to do was to go maybe every couple of weeks to go for physiotherapy. Is that a good way to maintain?
Yeah, absolutely.
It's a good way to maintain.
Yeah, going in and getting continual care is certainly fine. Yeah, I would agree with that.
Okay. All right.
That is what we call the maintenance care.
Maintenance care.
Just like having a car and then going
regularly.
Yeah, regularly. Yes, that's right.
Thank you.
You're welcome.
All right. So we'll be speaking with Dr. Craig Slapinski. He is the clinical director at the Spine and Nerve Center, Ghana, as well as Joseph Ahenkra. He's the head physiotherapist with the Spine and Nerve Center.